Welcome, everyone. We wanted to jump in a minute or so early while the door opens up. We have people coming in. So, welcome. If you are joining and you would like to put in the chat, maybe your state, maybe your city, please don't give out your home address. If you also want to put how long you've been diagnosed with migraine or your loved one that you're on the call to support, feel free to do that as well. That's always kind of nice to see where people are coming from. So we'll give it just a minute to see when the numbers stop coming in. So we have about 300 people registered for tonight, which is fantastic. I see we've got a New Yorker. Okay. So Dr. Monteith's in 80-degree weather. The New Yorker is probably probably a little chillier there.
Yeah, but they have better clothes than me.
Oh, yeah, they have more seasonal, huh?
Yeah.
All right, one more second and we will kick it off. Again, if you're just joining, feel free to give your city and state or how long you've been diagnosed with migraine or your loved one with migraine. Um,
I
I
would love
believe,
to see all 50 states represented. So far, we're doing good.
I know, I was just thinking there's a really big range. Absolutely.
Yeah, we got
Oh,
to get
I
all the 50 states.
see another Southerner in there. Well, and
Yeah.
Lindsay and I both represent, and we've got Vermont represented
Okay,
here
there.
and Philly.
Hmm.
So we're
Well,
actually pretty good.
That's great.
All right. Well, it looks like the ticker has oh, Montana too. My goodness. Oh my gosh, in Washington. Okay, Dr. Monty, this might be a first that we've seen this many
let's
states
do
represented.
it.
That's amazing. Well, welcome everyone. We're going to go ahead and jump in. We know this is a packed conversation tonight. I just wanted to kick us off and thank you all for being here. I'm Carrie Howell, the CEO for American Migraine Foundation, and we do these monthly. I think with the exception of December, we're going to take that 1 month off, but we'd love to have you join us anytime for these. We make these available because we read about the topics that are important. We hear about the topics that are important to you all as patients and your loved ones with migraine as well. And we really spend some time crafting what these sessions should be about. And so this one seemed very timely right now. So I just wanted to personally come on and welcome you. I also want to make sure you know that we are here for you. If you're not on our closed support page on Facebook, it's called Move Against Migraine. If you're on Facebook and you can't find it, that's fine. It's listed a little differently. We have a large, over 100, and gosh, Lindsay, how many people are on that now? It's over 100,000 easily, maybe 140, maybe 140,000. Yeah, she's giving me the thumbs up. So we'd love to have you join that as well. That's just a place for you to come and ask questions or maybe share your experiences. It's just a good place too to not feel alone that you're dealing with this really difficult disease. And sometimes it's just great to go, oh my gosh, I have that too. I get it. So but we welcome you as part of our American Migraine Foundation journey and our family. And so anything we can do to help you, let us know. But I'm going to turn it over to our editorial board co-chair, Dr. Monteith, and she is going to moderate tonight. I'm going to slip off, but Lindsay, if you don't mind just putting our website again in the chat and maybe our general email, the info in case people do have questions and need us. So thank you all for being here. And Dr. Monteith, I'm going to turn it over to you.
Okay, great. Well, thank you so much. Thank you everyone who logged on. Maybe you're having dinner. I know there's lots of competing things going on, but I think it's really important to reflect on migraine and, really access to care. It's such an important topic. And I think there's just no one better. This is the dream team right here. I promise you. I was asked who would be best at coming on and talking about this topic. And immediately I said, well, that's Dr. Brad Klein and Robert Shapiro. They're the two people, and they agreed to do it. And we know that both of you are super busy. And so we really, really appreciate that. So let me just tell you a little bit about these two characters. And I say characters because, I think I've known you since I was a trainee, both of you. I was a resident, going into fellowship when I met both of you. And so both of these men have had very influential roles in my career. So I'm very grateful. Dr. Brad Klein He is a headache specialist and general neurologist in private practice in Abington, Pennsylvania. Locally, he serves as CFO for his practice and medical director for the Abington Headache Center. He also serves in multiple state and national roles and serves as a patient advocate from local payers to the halls of Congress. I love that. Dr. Robert Shapiro is a professor emeritus of neurological sciences at the Larner College of Medicine of the University of Vermont. He's been active in clinical practice, research, education, and national advocacy for more than 30 years. And both of you, this is very humble introductions. We're also really lucky to have Lindsay DeSantos. She's been a volunteer patient advocate in the migraine space for several years. In addition to the American Migraine Foundation, she's been involved in Miles for Migraine, Migraine Again, Migraine World Summit. Lindsay has been interviewed by many publications about migraine, and her diagnosis story was published in Prevention magazine. She's now thrilled to be part of the American Migraine Foundation in her role as advocacy and program manager. And we're also really lucky to have you. Let me tell you that. I feel like we talk every day. And I think we're going to really get into the weeds of insurance and how its relevance for migraine care and optimization. But I think we should start off with a patient story and the patient journey. So, Lindsay, do you want to share your experience? You're on mute.
Oh, of course. Okay, sorry. Well, healthcare is always something that I felt like I couldn't take for granted, but I've had many seasons throughout my time, especially as migraine has become chronic for me. And so I know that the journey of trying to find what works and then trying sometimes having to go through 3 or 4 things that don't work to get to the original thing that your doctor prescribed for you. And we'll be talking about that more later. So that has happened to me before, and I felt like the weight was a down, spiral for me because I was not getting the right medication. And at one time I was episodic. And I feel like that was a force in bringing me to being chronic. In addition to that, the frustration with insurance has been I was on a medication for 2 years. It was approved, gone through all the steps, and then they would not cover it. And so it was kind of in a panic, there wasn't time. This was a great preventative for me. And it's been a long road for me with migraine. So I went from having about 7 migraine attack days a month to 20, almost 25 the month that I did not get that medication. And then unfortunately, I don't really feel like I got back to where I was before. So it's a really important thing. Insurance is highly up on my list because you need access to care and you need the right care. So that's why I'm so thankful for what we're sharing tonight, because I know everybody wants that.
So that's tough. You went from episodic to chronic, and part of that was under treatment and lack of access. So, I mean, I think this is a story that we hear, and we've actually wrote a paper on that we can also put in the comments about that, where people can really understand this is unfortunately too common of a problem.
Mm-hmm.
And, I also want to be sensitive to the fact that we're, right now in the middle of a government shutdown, and, some of this argument's based on insurance coverage and premiums, and that there may be some anxiety going on right now. And so I hear you, I feel you, and we're in this together. And we're going to focus on some potential solutions. So why don't we start off with open enrollment? This is the open enrollment season. Dr. Klein, why don't you tell us, what do we need to know about open enrollment as it relates to migraine? What factors are important when people consider plans?
Yeah, thank you, Dr. Monteith and Lindsay. That's an important story, and I can see in the chat that this is a common story, and I think all of us, whether it be patient or physician, advanced practice provider, we've seen that, we've felt it, we've dealt with it, we've managed it, we've hopefully succeeded through it. Sometimes I imagine we have not, and it's been a challenging state for all of us for a long, long time. But I do think when we're talking about open enrollment, there's several different layers to this, right? So it depends on the insurance that you've got. It could be anywhere from Medicaid to Medicare. It could be commercial. It could be this, the Affordable Care Act and that just healthcare.gov where you can get that health insurance marketplace option. So you want to know where you are in your life stage because if you are 65 or older, then certainly Medicare Advantage could kick in, or you're younger, or there's other disability that might put you into that world of Medicare Advantage as well. But from an open enrollment standpoint, we really think about that health insurance marketplace as one of those places, as well as the Advantage programs. So I think there's a few things that we all want to keep in mind because it can be very frustrating that you sign up for a plan and you didn't really go into the details of the plan and you realize on the back end, once you've signed up and you're stuck in that plan, you could be trapped with a program that you're not happy with. You might not have the providers that you want in that plan. You might not be able to get the medications that you want. So if you're in the health insurance marketplace, you're going to go to healthcare.gov. It's really critical that you do due diligence now. It's kind of like in carpentry, measure twice, cut once kind of thing. Same thing applies to this situation. So understanding, first of all, are your providers in network or not? And you can also see some of those medications that you might be taking. Are they also in a plan that will be covered for you specifically? The other thing is, of course, cost. And there's different approaches to this. There is the idea that you have a lower premium where you pay less per month, but then you might have a high deductible, so you're paying a lot of money up front in order to get any medication or even see your providers. And particularly if you're on some of these more expensive medications for those first couple months, you might be paying fully out of pocket, $1,500 easy for a particular treatment, for instance. So you want to know what you're getting into before you do it. So one of the ways that you might want to consider looking at your financial costs is, taking a step back and looking, what services did you pay for through this past year? And then what you can do is you can go forward and say, well, if I paid for these services this past year, maybe it'll be similar to the following year. And you can almost do an estimation of what that total cost is going to look like. So that way you at least have a feel for where your costs are going to be. Maybe you're better off having a higher premium because you're going to spend that much money anyway, plus. So you can actually save money by going in this pathway. So if I had to summarize it, it's really about making sure clinically you're seeing the right people because it's covered by your insurance. And then second, making sure that the finances make sense to you before you sign up and lock yourself into a program. I will just say that Medicare and Medicare Advantage are not the same. Medicare Advantage is actually commercial carriers who present with Medicare details and values, but they are not the same. And you really want to make sure you understand both because the commercials are heavy in Medicare Advantage and not as much in Medicare. And so with Medicare Advantage, you might get more benefits, but you might have that prior authorization process. You might have that step edit process that's a little more aggressive than the Medicare plan. So understand that nuance before you go into it and making sure that you're talking to even your provider about this before you sign up.
Is there a way to navigate some of this early on in terms of like medication formularies? You may not know what your doctor wants to change you to, or even comorbid conditions. So you want to see your headache specialist or neurologist, but maybe you also have anxiety and depression or a sleep problem. There are lots of comorbidities associated with migraine. So how do we manage that complexity?
So there's unfortunately not a great number of resources that exist specifically to address this, particularly for the individual person. And this is going to be a little bit of a twist that, I don't think many of us think about doing, because when we see providers, it's usually about our annual wellness or it's about the challenges that we're dealing with that for that particular visit. Of course, in our world, it's migraine. But maybe there's a value in meeting with your provider as a clinical visit to go through some of these questions where your provider can actually tell you, well, here's the things that you need, and here's some of the things that we can do together to ensure that we both understand what you're getting into before you sign up for it.
And maybe some plan B or C or D, and even checking to see what those eventual plans might be and whether they're even on the formulary.
Exactly, because as a provider, I know generally what additional medications I might be thinking about for you. And so with that insight, you can then plan accordingly where you might be going. And that way you can gauge your costs in advance of going into that particular insurance program.
Dr. Shapiro, do you have anything to add to that? I know we were going to give him the hard open enrollment question, but
So I think it's a terrific summary. The Medicare issue is particularly complex because Medicare will only provide coverage for care that they deem to be, quote, reasonable and necessary, which is really an arbitrary decision on the part of the Medicare administrators. And consequently, issues like prior authorization or different schedules of different medications being covered or different co-pays, all those things can apply in Medicare as well, which is why there are these other products which are available. There are commercial products that Brad mentioned in terms of Medicare Advantage. There's another product called a Medigap, which provides some coverage which wouldn't be covered by conventional Medicare. And finally, there's the pharmacy coverage, which is a separate one. So I can't emphasize enough what Brad had stated, which is that now is exactly the time to do the research on this, because if your plan expires, whatever you're on right now, or what you're expecting to become covered by begins with the new year, these 2 months go very quickly, and your ability to get the information you need and make kind of a rational, calm decision about which is the right course it's really best to get on it right away.
why don't we also talk about being underinsured and how do patients, I mean, maybe in many ways, a lot of people are underinsured, even if you have good insurance, because you have to go through that step process, which we'll talk about. But in those that have actually no insurance or underinsured, and some of these could be very healthy people, but just younger people, a whole diversity of people, how do we navigate that? We know that there's certainly having a lower socioeconomic state is a risk factor for chronic migraine or even migraine. That might be associated with transportation issues, other issues, and even getting to the doctor. But how can people navigate the process? Are there any tips that we can think about when it comes to like accessing care, both medication and providers?
So it's probably best to at least go over some of the data about how this impacts people with migraine. So migraine is more impactful. There are a higher percentage of people in the US who have migraine who have lower income than higher income. And it's just under half of all people in the US who have migraine who have an average income of less than $50,000, which, depending upon how big your family is, that could be below the poverty level, the federal poverty level. And a high percentage of those people who have income of less than $25,000 a year are uninsured. That is, about 19% of people with migraine are uninsured in that group. And these are data from a couple of years ago. And about a third of them are on private insurance, which means that the remainder are receiving Medicaid or something similar to that. Generally, it's Medicaid. And a difference between Medicaid and Medicare is that while prior authorizations can apply, et cetera, ultimately, if you pass through the different steps that your Medicaid plan requires, and we'll talk about step therapy shortly, if it's an FDA-approved product, they have to cover it. So it's a little different from Medicare, where they can actually refuse to cover it, and you may need to go to another plan, meaning like the Medicare Advantage or the Medigap, et cetera, or a prescription plan in order to be able to have it covered. So, but if you don't have insurance, and unfortunately, this is, as you mentioned, Tisha, this is a kind of a critical time with about almost 5 million people who will lose their insurance this weekend because of the loss of the Obamacare premium subsidies. A high number of those people high percentage are people living with migraine, about 15%. So it's somewhere around 750,000 people with migraine will lose their coverage this weekend. And addressing that is kind of a general question across the U.S. because these are problems which impact so many people, including the fact that premiums will be going up for everybody else who is in the marketplace, whether or not they're receiving these premiums, because as people leave the marketplace, the remaining people who are covered are more likely to be those who have higher medical needs. So, what can we do about this? Well, we'll talk, shortly, I think, about advocacy to try to address, the loss of the premium subsidies. But I think finding the least expensive way of managing this is a difficult needle to thread. So looking for, if you're paying out of pocket because you don't have insurance, then thinking in terms of supplements, which may be helpful for managing your disorder like migraine, and talking to your healthcare provider about that. Looking for pharmacies which have reduced prices like GoodRx or through Costco. These are also ways to try to manage it, but there's no sugarcoating it. If you lose your health insurance, it's a huge burden and a difficult one, because it often means that you have to make choices which no one should need, should ever have to make in terms of food security or other essentials.
Yeah, so I think that's a good point that as difficult as it can be, there are some opportunities to purchase things at very low cost, like triptans, for example, with some companies, and maybe they really advertise one out of the seven. I know some people that go to Canada and get things online in Canada and are able to pay out of pocket for some particular drugs. There's some the non-specific drugs can be generic, like the beta blockers and the tricyclic antidepressants. That might be a little bit more affordable. But for those that have tried many of these things, then they find themselves in a rough spot. And so I think having a conversation with your doctor about your insurance status, and if you're paying out of pocket, don't be afraid to mention that you're paying out of pocket, because then they'll have to look into the cost of some of these therapies. And then some of the newer therapies do have foundations that if you meet their threshold, you can apply and get some of the drugs for free.
Thank you, Tisha. That's exactly a critical point to recognize that, even if you have a salary, you actually still might be able to utilize some of these foundations. I've been very impressed with some of these pharma companies with their brand name medications offering their medications at a reasonable salary that's way above poverty line, but willing to help nonetheless. The other thing I would emphasize is that from a provider standpoint, if you don't have insurance, and again, no insurance whatsoever, one of the things that you might also be able to do to still see your providers is talk to your provider. And if you can, assuming that, the finances are viable for you, if you talk to your provider and pay the day of the visit, the provider may be able to offer you a significant discount. Uh, Legally speaking, we are beholden to not change our charge rate as a physician or clinician. But if you pay the day of the visit, we are offering that same service to all insurance carriers that we work with too, we contract with. So in that one situation, again, if you pay the day of, then the provider can legally offer you a reduced price if you feel that that's something that you need to do. And the other thing I would mention is, telehealth is, of course, something that is viable for us. So if in case you can't see one provider, maybe there's another one within the state that might still be able to see you and help. The last thing I would mention is that many of the universities do have resident clinics where they take people who don't have insurance, and that would allow you to get care. And oftentimes, particularly if there's headache specialists in those universities, we may rotate through those clinics anyway, so you still could see potentially headache specialists. But even someone who's not a headache specialist is not necessarily a bad person for you to see too.
Yeah, they're usually a good person.
Usually a good person.
Two other points. One is I would caution people about going online for pharmacies which purport to be from Canada. There are lots of cases where these are not necessarily organizations based anywhere near Canada, and they're not necessarily selling you something which is the product that you're looking for. They're counterfeit drugs, and it's been a big problem. The other point, and this is to underscore Brad's comment about telehealth, for many people, many low-income people, it's a huge issue in being able to get to a clinic across a long distance, particularly people who are in rural areas. And also for people who are working multiple jobs, finding the time to be able to take out to do that is a huge burden. And telehealth, fortunately, is much more appropriate for headache medicine than many other fields. And most headache specialists now really rely on it in most instances, not necessarily for initial visits, but for follow-up visits. It's often very appropriate and helpful.
And that's an active area of advocacy to really just try and extend that telehealth to make it become permanent, especially for Medicare patients where there's a concern that, it may not be extended. Great. So before we move on to step therapy, are there any misconceptions or gaps in knowledge when it comes to Medicaid, Medicare? I know you mentioned that the FDA-approved drugs should be available to patients, so I think that is a misconception. Are there any others that we should really think about that may be missed opportunities for many patients?
Well, one thing is that neither Medicare or Medicaid will cover the neuromodulatory devices that are becoming so prevalent in use for headache medicine. And I don't see that changing anytime soon.
Well, I think actually, I don't want to misspeak, so I'm not going to misspeak, but I believe the Nerivio device has made some headway, but I think we'll just leave it there as a follow-up. But I agree, by and large, and that's true for the private insurance, right, as well.
I do have the I'm so sorry to interrupt. I do have the Nerivio, and it is now covered by my insurance. So
Yeah,
it took a
that's
while.
very limited. Yeah,
Yeah. Sorry to interrupt.
yeah.
There are limited private insurers which cover only Nerivio, as far as I know, not any of the others. If
Yeah.
you're a veteran, they're all available.
One other thing I just want to make sure everyone is aware, if you have Medicare specifically, traditional Medicare, there's a Part B and a Part D that hopefully you're familiar with. So Part B is related to physician offices. Part D is the medications that you get in the pharmacy, for instance. So if sometimes some of the medications that are, something you get in the pharmacy may not be covered or be very cost prohibitive if it's a Part D situation. But if it is a medication offered in the physician's office, such as botulinum toxin A or others, and Vyepti, for instance, a CGRP infusion, because those are Part B covered by Part B, they actually could be covered despite the prices that they are.
So when we talk about step therapy, because that's a barrier, we're talking about insurance being underinsured and having lack of access, but even if you have good quality insurance, sometimes it may not feel that way when your doctor is recommending certain treatment options and then that's not getting covered. So Dr. Shapiro, can you spend a little time on first educating us about what step therapy is and some of the barriers associated with step therapy?
Certainly. So step therapy is basically a policy that insurance companies or pharmacy benefit managers, which handle your pharmaceutical coverage, they impose to restrict the availability of some medications, which typically are more expensive that your doctor or other provider has prescribed. So in the case of preventive medications, instead of prescribing one of the branded CGRP medications, which are more expensive since they're still on patent, they may require that you so-called fail first, one or more generic medications, typically medications which were not originally developed to treat migraine, were found incidentally to be helpful. They were originally approved for, say, depression or epilepsy, and even some medications that aren't FDA approved for treating migraine they may require, such as tricyclic medications that were approved for treating depression. And you may have to cycle through several of these before your insurance carrier will start to cover the medication your doctor had prescribed. And there's a huge opportunity cost to this. First of all, the medications may be less effective. They may be less effective for you in particular. They may have more side effects. And with delay in treating your condition, particularly for a condition like migraine, it can progress and become more severe and become less treatable, less tractable. So there's a huge problem with step therapy in our field. And in particular, because the new class of medications, the CGRP medications, have been thoroughly vetted with appropriate FDA trials to show their effectiveness and their tolerability. They've been deemed by the American Headache Society to be first line, so that they shouldn't come as a fail first. They should be the first medication for a patient to receive if that's what your doctor had prescribed for you. So this has become a huge issue. It's not just within our field of headache medicine, it's across all of medicine that there are these restrictions that are often imposed with something called prior authorization, where your doctor prescribes something and then there's this dialogue between your doctor and the insurance company, which sometimes needs to be appealed, and time passes before you finally learn that you're not going to receive the medication and you're going to have to take something else, which neither you nor your doctor wanted you to take. So this has become such a big issue that in Congress, there's been a lot of activity around this over the last several years. And there's a particular bill which has been introduced in both the House and the Senate for the last several Congresses, and it's now been introduced in this Congress, called the Safe Step Act. And the Safe Step Act is it's a step in the right direction. It's not a full answer to this. So it provides exceptions to this prior authorization policy for people who have legitimate reasons why they should not have to wait and go through the process of taking something that wasn't originally the drug that was prescribed. And these exceptions are clearly outlined in the bill. If you've taken this drug before and was ineffective, if it was clear that delaying starting it would produce a severe or irreversible type of consequence, if it's the drug is contraindicated for some reason, you have an allergy to that class of drugs, even if you haven't tried it, if there's evidence that this would limit your so-called activities of daily living, the important things like being able to bathe and dress and things like that because of the medication. These are all potential exceptions. And finally, if you were on the medication, it was working well, and you were on a stable dose, and you changed insurance carriers, the new insurance carrier would be prohibited from blocking that medication just because you changed insurers. So these are all exceptions that are written into this law, should it become law. It's now a bill. And there's also a time limit on how long the insurance carrier can wait. So if it's an emergency, they have to provide an answer within 24 hours. If it's not urgent, it's within 72 hours. And this is a huge benefit for everyone who is receiving medications, prescription medications, because this is the basic issue. It has limitations. So this bill only applies to people who receive their insurance through their employer, through an act called the ERISA Act. So it doesn't really apply to people who are on Medicaid or Medicare, or even people who have received their insurance through the Obamacare markets. So it's really only through insurance plans. And there are also some other limitations on it. It's not a ban on step therapy. It's an ability to provide exceptions to the step therapy when applicable, but it doesn't completely eliminate it. And finally, it doesn't cover an important area called quantity limits. So your doctor may prescribe medication for you, and the insurance carrier may say they'll cover it, but they will only cover an insufficient amount to actually treat your condition. So it's virtually the same as not covering it all if it doesn't actually provide the therapy that you need. And in particular here in Vermont, where I live, there's an insurance carrier, which I won't go into the details, which has these quantity limits, which are really very burdensome and inadequate for some of the CGRP medications. And we've been engaged in trying to address that. And, so these are all steps in the right direction. Should this bill become law, I'm very hopeful that similar bills will be introduced to try to adjust the same sorts of issues for Medicaid and Medicare and the Obamacare marketplace, et cetera. But it's a start.
That's great. And this is a bipartisan bill?
Yes, bipartisan bill. It had a huge number of co-sponsors in both the House and the Senate in the last Congress, and it was actually going to be included in a continuing resolution, which continues funding at the end of last year, but through some political issues, that didn't happen. So people are very optimistic that this bill will pass and hopefully will be signed into law, but it's probably not going to happen until the spring at the earliest, from what I've been told.
So how could our listeners or migraine community move this forward? I mean, it sounds like something really important for us.
Yeah, I think it is. And fortunately, multiple organizations in the advocacy space for people living with headache disorders have joined together in a single coalition called the Alliance for Headache Disorders Advocacy, and that includes the American Migraine Foundation, American Headache Society, and about a dozen organizations total. For an organization called the Alliance for Headache Disorders Advocacy. And you can go to their website. It's allianceforheadachesadvocacy.org. And there is if you go to the menu for that, actually, we'll put it in the chat what the address is. If you go there, there's a tab you can click on for how to get involved. And there are two clear ways you can get involved right now. One is you can contact your members of Congress saying that they should sign on to be co-sponsors of this bill, whether they're in the House or the Senate. And it's an extremely easy thing to do. There's a whole website which makes it very, very simple for you to do. And you can put in your own message about your own experience and why this is important to you if you like. The second way is you can get even more involved directly, which is you can come to Washington with us and you can make your voice heard. And we have an event called Headache on the Hill, which occurs twice a year, where advocates from all states come to Washington, or in the fall we do it virtually by Zoom, and you meet with your congressional offices. So sometimes you're actual members of Congress, often it's the staff, but they're key people to be able to interact with. And right now, applications are being accepted to come to Washington for the spring. So it would be actually in February is the next event, but the applications close on December 10th. So you need to apply before then. So there's still about 6 weeks before that's closed. And you can easily apply online through this website, allianceforheadacheadvocacy.org. And we really encourage you to come.
How many have you been to?
Oh, I've been to all of them.
What's all of them? How many?
They started in 2007. It's been an annual event, and it's been twice a year, including the virtual event for the last several years. So I've probably been to about, I don't know, 20, 22. I don't know.
And I should mention that you're the creator of this, of course, with the support of the American Academy of Neurology, but this was your brainchild, and it's brought, I don't know how many hundreds of people to the doors of Washington to really fight for the needs of people with migraine, patients, doctors, residents, trainees, just really a beautiful thing.
Thank you. I can tell you it's an extremely gratifying thing to go. And if you feel like you're frustrated and you can't believe that government's not working for you, and that in particular organized medicine is failing you because you're not getting the kinds of therapy and improvement that you think and you certainly do deserve, this is an extremely practical way that you can give voice to that frustration in concert with many people who are experiencing something very similar. About three-quarters of the people who come to Headache on the Hill are patient advocates who are living with migraine or other headache disorders. And the remainder are doctors and researchers and nurses. And it's anybody who cares about people who have headache disorders will show up for this. And
Excellent. So I also want to talk about some more practical steps, and make sure you do sign up to that link, and at least just kind of follow the website. There are letters that you can write. If you can go, that's wonderful. But let's talk about some practical tips between patients and doctors and how to move their care forward. So maybe Dr. Klein, you can answer this question. What could patients do even before their appointment to try and help optimize their chance of getting approvals for their insurance?
Yeah, if I may, I feel the need to mention one last thing about the wonderful work that Dr. Shapiro has done. When Dr. Shapiro started this, and I was honored to be a part of the process at the very beginning as well, the vast majority of physicians had no idea how to do any advocacy work, to be frank with you. And certainly many of the patients, as we brought, patients involved in this process, had no idea either. And it was a fear for many people, and including myself when I first started doing advocacy. Well, how do you do this? How do you move the legislator? Some people see them as celebrities, and it's very daunting. And going to the halls of Congress is larger than life. But one of the beauties of what AHDA will do is, if you decide to go, is you'll be trained on how to do the advocacy as well. And you'll be with a group of people who also know how to do it. So you'll learn to do this and be an effective advocate. And even when you feel like, you didn't get any very far, maybe that first visit because this is new to you, the more you do it, the better you get at it, and the more the representatives actually know you by name. It's been a fascinating journey as well, having been a part of this with Bob and with Tisha as the years have gone on, and seeing the outcomes has been dramatic, but it's only because of the great work that people like Bob have done to make this viable and have our voices magnify the original vision of Bob to bring this out and make this something really great. And the advocacy work that's been done really is now known on a national scale by many organizations as well as Congress specifically. So it just takes the individual voice to make the difference. So anyway, sorry, I couldn't help getting on that little bit of a soapbox.
Yes, yes. Like I said, you've been around
Yeah.
for a
Um,
while. Of course, you're still young. Don't worry.
I,
Um,
I hope so. Thank you. Appreciate it. I don't feel at times, but anyway. So there are
yes.
a few things to think about when you are, going to see your provider for that visit. And it's really important for us to be able to care for you best, as well as be your advocate too, and with payers, is to recognize number one, the medications that you've tried and failed. If you can have that list ready for us for that first visit, and certainly even maybe hold that list for yourselves as well, and then communicate what you've tried and failed, whether it be preventive medicines or abortive or rescue medications, even broken out might be helpful. Ideally, the time frame that you tried those medications. Did you have, did you get to a therapeutic dose? Do you know if you know the medication dose? That's a phenomenal component to have. And if the drug wasn't effective, let us know. If you had side effects, let us know. It is not uncommon that we do see patients that say that they tried a particular medication, but they only tried a baby dose, let's say 10 milligrams, When you need to get to 100 milligrams, as I describe to my patients, it's like spitting in the ocean and expecting to rise. You need to get the therapeutic dose. So letting us know where you've gotten to in those medications can make a huge difference in your care going forward, so we don't miss opportunities for you. And maybe they're inexpensive and we don't need to go to brand name drugs to get the job done for you necessarily, where it goes through the prioritization or step edit process. So that will be one very important thing to keep in mind as you're seeing your providers. The second thing to keep in mind is to try to help us quantify to the best of your abilities, how you are experiencing your headaches, your migraines. How frequent are you with your headaches? How many days per month or days per week do you experience headaches? What is the severity on average? In my world, I like to say 0 to 10, 10 being the worst pain you can imagine. What are you averaging and what are you ranging? And then the last question is, how long does it take per attack to get it under control? Because if you can't get under control for 24 hours, then the rescue medicines that we're using are probably not well enough, not effective enough for you. And with that information, it tells us, number one, are you episodic migraine or chronic migraine? And it also tells us, are the regimens that we're putting on effective or not? Not only for our clinical ability to take care of you better, but it's also important from a payer standpoint, because some of these medications, particularly the ones that are a little more expensive, the payer may want to know that after being on it for a period of time, there's some improvement. So by creating some sort of quantitative judge, some sort of signal that there's improvement, will also not only get you to the drug, but also keep you on the medication longer.
And is there anything, so I think you mentioned some key points to just even maximizing the existing medications that may be tried, and maybe there was something with that trial that may have been sketchy, but even having that list to document, the better that doctors are able to document for their patients, the better they can advocate on getting the treatments that may be more effective for that patient. So I think that's a really good point. Dr. Shapiro, do you want to add anything to that?
I think it covers it very well. I would say the key thing for all patients is to meet your doctor or nurse practitioner or in the middle. So this is your health, and if you want your doctor to be the advocate that you need, and every patient needs their doctor to be an advocate for them, then you need to do all the homework that's going to help with that. And as Dr. Klein mentioned, being clear about what your history is, and taking good notes and having them be clear so that it's easy for that information to be transmitted is really an important, helpful thing. But finding a doctor who will understand that you're going to need their help to get the therapy that you're entitled to is really an important part of this. And there's no way to rehearse that. There's no way to kind of ask anybody specifically, are they going to go to bat for you? But if you're finding that you're just not getting that support, then you may need to find somebody who does provide that support.
Well, even before doing that, it's useful if something's denied to say, can you appeal? You should know that you have the right to ask for appeal. So maybe we can talk a little bit about the appeal process, that what goes into the denial. The letter comes to the doctor and also hopefully to the patient. What is that appeal process, and how can patients best navigate that process?
So, as Brad was mentioning, having all the information available, having it documented in both a letter that your doctor is going to send, which is the most important, as well as perhaps a letter that you send, which unfortunately is less important to these insurance carriers. That's the first foundational step. And then you just have to have some faith or confidence that the process is, truly in good faith, which is to say, I've interacted with a number of insurance carriers where it was clear that the appeals process was really just perfunctory, that the idea was to occupy as much time and administrative time from a doctor's practice as possible until they just capitulate and say, I just don't have time to do this anymore. And unfortunately, there are some predatory insurers who have that practice. And if that happens, and if you have good evidence that it's happening, then there is redress. The redress is that all of those companies are under federal regulations, and you have a congressperson who actually has a home district office that you can present this information to. And believe it or not, they actually do want to please the voters. To say no is actually something of a perilous thing for members of Congress to do. So in a last resort case, I would say in my case, it tends to be more first resort because I've been doing this so long. But in a last resort case, there is an appeal that's higher than the company itself, and that's to go to your member of Congress. And believe it or not, that often stirs things up enough.
And I know that AI tools are being used these days, at least with some limited capacity in this process.
So I would say, yes, that's certainly true in writing letters and all that. I would be a little reluctant to put all of your medical information into a chat box. That in anything you put in, this is
Yeah.
sidebar issue, but anything you put in asking questions, the AI is being trained on that information. And so I'd be
More on the insurer side, they have their tools, right?
Yeah, the insurers are utilizing AI, and the consequences of that has not been good for patients early on. There's a lot of data that's now been demonstrated suggesting AI is moving faster than it should be, and the consequences of that is poor patient care, where patients are being denied utterly inappropriately for a lot of cases. Unequivocally, this is the beginning of this. So, I think there's a lot of mistakes that by default occur. It shouldn't be occurring in the context of patient care ever. But I think as time goes on, that AI is going to sharpen itself, both for payers and hopefully for us as providers and patients.
And I would say that there are also some tools. The American Headache Society came out with a position statement stating that CGRP therapy should be considered first line, not necessarily the number one drug to use. And there are many times that you want to use the non-specific therapies, but that if a doctor or nurse practitioner feels that the patient should really get this and may be useful, some doctors don't know about this position statement. So if you have access to the position statement, these are freely available and downloadable. That might be a helpful tool to send to your doctor, who may be a primary care doctor or a neurologist or other subspecialists. Any other last tips? And I do want you to feel free to put your questions or comments in the chat, because we will leave a little bit of time to answer questions that are active. Any last tips before we get to the questions?
I just think, as we talked about, it's so important to make sure that you're communicating with your provider and letting them know, are you getting the results that you're looking for, is really important. It's so common that people just say, oh, well, I've got this and it is what it is.
Yeah,
Don't accept that. Certainly it can be difficult, but make sure that you and your provider have that dialogue to make sure you both are on the same page as to where you are, and are you reaching the expectations that you're hoping for, and have that communication bilaterally.
I think communication is so important, because it's so often that people may assume that people are fully aware, and the truth is that every person deals with things differently. And so it's very important to have very open communication about your goals of care. And if the treatment is not working for you, don't wait 6 months, don't wait a year. I think that if you're also having side effects, certainly early communication is better, because that might help move that needle forward to really hone in on the best, safest, and most tolerable treatment strategy for the individual. Great. So let's see if there's some questions. A few people had asked about the foundations, and many of the pharmaceutical companies do have foundations. So I think that if there's a drug that is a brand drug, not yet generic, it might be useful to look up that company name and find out whether they have a foundation or not. And your doctor certainly can help you with that process. There's someone that mentioned a nice idea about even when you're having a little bit less migraine days, still picking up your prescription so you can stockpile for when things are worse. We tend to think about that, I think, for patients with another condition called cluster headache, but I think that's super important also for migraine as well. So thank you for that comment. Let's see what else we have here. Someone is just mentioning that they've been documenting since age 15 when they have a bad migraine nonstop, and there's a list in the cloud with all the medications I've tried. Well, thank you very much. You're ideal. We may need to get you on and be one of our coaches one day. So thank you for sharing that good habit. Let's see other things. Any role for the State Board of Insurance in the appeal, denial, and ignore process? Maybe we'll let Dr. Klein, I think we designated you to answer the hard questions. Because you didn't show up to our meetup before, so you get punished. Go ahead.
That's what's being called voluntold, right? Certainly there is a place for that, and I can tell you that even within my own state, I've actually utilized that service. Every state has a Department of Health or Department of Insurance that oversees and regulates these different insurance carriers. It is not always a effective way, unfortunately. It depends on the situation that you're in, and you've got to make sure it's clear that it doesn't match up with what would be considered legal. Certainly, you don't know that necessarily until you try. So it's always worth trying because they will be required to investigate any issue that does come up. So it is worth your while to pursue it and then see where that leads. Certainly, I can tell you from personal experience, no insurance carrier wants to be under the spotlight in an adverse way. So that is valuable. The second way that is important, as Bob said, is talking to your either federal or state legislator, your local legislator, to let them know what's going on. Because again, no insurance carrier wants to be under that spotlight with a legislator looking at them adversely. And I can tell you from personal experience that has been helpful in the past.
Someone just also mentioned, very good point. I often tell this to my patients, that you can get a list of your medication history from your pharmacy. So if you go to the same pharmacy, you've been doing that for 10 years, you can ask them to help you with a list. And that is very helpful because people sometimes forget the doses, and even you can count how many refills you've had to realize how long you've been on that particular medication. So thank you for that tip. I think that's great. There are a few people.
Throw
Yeah,
in
go ahead.
one other quick little detail. Sometimes it's also about what is in the policy. We tend to get frustrated that we can't get a medication through. And again, there might be a step edit process, but invariably, I believe, when you are denied a particular medication, they are required to send you some sort of information. It may not be as transparent as we want, but understanding, all of us, not just clinicians, but even patients, understanding why are we getting blocked can be helpful to figure out how to solve that challenge. And it may not require going to a legislator. It may just need to understand what was being missed. Maybe there was an error by the insurance carrier that they missed a failed medicine, for instance, and it's just a matter of letting them know. So sometimes it's not the hard fight. Sometimes it is the low-hanging fruit that we need to make sure that we haven't missed, and there was an oopsie in the process.
So
A few people.
Go ahead. So I'd add to all of this. So Medicaid is different from Medicare in that it's a joint federally administrated and state administrated program. So your state really is the one that determines policies under regulations of the federal government, which means that the policies for which drugs are preferred and which drugs are not under Medicaid are determined for your state by what's called a Drug Utilization Review Board, a DUR board. And they actually are accessible. They meet on a regular basis. You can find on your state health department website when they meet and where they meet, and you can look, and they review new medications that they haven't already decided where they're going to place them on the formulary. And I've testified before the Vermont board a couple of times, and every time I've been there, I've been the only doctor in the room. It's a bunch of people, from pharmaceutical companies, and then it's the people who are sitting around the table who are making the decisions. And if patients show up and you're entitled to provide testimony, it's open, at least it is in Vermont, and I'm pretty sure that's a policy across the country, then your opinion actually can carry a huge weight in that situation. But it takes some initiative to really get engaged and see that as an opportunity and find out when the medications that you're most concerned about are coming up for review.
I have a couple of people are asking about, well, a few people are talking about copay. So I think the copay assistance program is great. It's, ideally it would be affordable, but I think copays, at least for onabotulinum toxin A or Botox, and someone's mentioning the Vyepti, their experience with Vyepti copay program. Many of these branded drugs do have copay programs, so that's also something you can ask your pharmacist about. Your doctor sometimes may also be knowledgeable about the copays. Someone is asking about how to communicate with doctors or how to find a doctor that they can communicate with. I think that goes along the area of access. And Lindsay did put a nice reference on how to communicate your needs to your doctor. So I think that's important. And then a plug for the American Migraine Foundation that has a site where you can search for headache specialists in your area, which many of these people feel very comfortable with talking and having difficult conversations because by nature of being headache specialists. Okay, so it's 7:00. We do have a few more messages and we have some clinical questions. Unfortunately, this is not kind of the time to talk about the clinical questions, but hopefully we'll capture some of these and maybe someone will be able to get back to some of these patients or at least provide some resources for the clinical questions. Any last things that we may have missed? Lindsay, how do we do? Did we do okay? You're on mute again.
I'm muted. Sorry, I was trying, based on that last question, we have the Find a Doctor tool with the American Migraine Foundation. I was working to put that one in. It is something that's kind of slightly under construction, but it's a great resource to start, especially if you don't know where to start. But this was amazing. Our doctors are full of such useful information. And so for me, I feel like you said some people think they're celebrities. I think you guys are my celebrities because you're you're just so important. So thank you.
Well, if you go to Headache on the Hill, you'll likely get signatures from both of these gentlemen.
Perfect.
Yeah, great. Well, thank you so much. And it's another wonderful webinar that we've had. If you like the webinar, please share it with your friends. If you want to support us, even small donations, we're happy to take those. If you want to just kind of sit and enjoy the resources, please, we want your comments, we want your feedback. We just want you to be part of our community.
Absolutely.
Thank you.
Thank you, everyone.